We were really interested in how mental health is connected to human flourishing and well-being. So we were very interested in how this very old philosophical concern finds new expression in mental health apps, which are designed with a particular conception of what human flourishing is and what well-being is in mind. So we were interested in how this could be a site of concern and also led designers to have to make lots of really important decisions about how they were going to design these apps, what sort of mental states they wanted to nudge people and to encourage people to take up. So we wanted to expand this and think about it in a newer way, one which paradoxically enough doesn't get a lot of attention within AI ethics and within other ethics of technology areas, because this looks at what well-being is from an intercultural, from a feminist, and from a disability studies point of view. We felt that these voices were lacking within the current discourse, and we were lucky enough to have the opportunity to write this white paper to hope that we might be able to change that.
So we're both philosophers by training, and the interest or the expertise that we can bring here comes from philosophy of disability and disability studies, and feminist ethics as a branch of philosophy. So perspectives from the ethics of disability and from feminist ethics have several advantages in the mental health app space. They offer us tools that allow us to take into consideration some potentially neglected values, things that don't come into the discussion so much. We're just focusing on privacy or on, let's say, respect for autonomy. Um, and also some observations about the human condition that medicine and medical technologies have often not sufficiently considered. So, both fields, for example, disability studies and feminist ethics, call our attention to human vulnerability. I think that we both come from a starting assumption that the design of technology, design in general, is never ethically neutral. There's no such thing as a ethically neutral or value neutral technology. Um, so things are always being prioritized over one another, even if they're both very important values, like let's say physical health versus mental health, right? Those two things could potentially be in conflict. And some of the ways in which this happens in applications of digital mental health care um, is in the way in which the design influences our behavior. This happens sometimes in ways that we're quite aware of and ways that we seek out because we want to change our behavior. And that's part of why we're using the technology. But sometimes it happens in ways in which we're also kind of unconscious of. So there are behavior change strategies that are built into many mental health care apps. So these help people achieve their mental health goals, for example, their mindfulness goals, or to cease kind of engaging in certain behaviors that maybe are not helpful for them. And all of these things can be manifested in the design. So the frequency of push notifications or the way the interface looks. These things can change people's behavior, and that's not value neutral. Most medical technologies historically have been designed with a certain kind of person in mind. And that person was a man, and they were usually a man, maybe like in peak physical condition or at least middle age. So they were designed for certain kinds of bodies and certain kinds of minds. And this leaves out a lot of people and makes assumptions about what a normal body and a normal mind are. And both disability studies and feminist ethics can draw our attention to who's being excluded from that picture and whose needs maybe are being excluded in the design that results from making those kinds of assumptions.
So there's a sort of wide range of stakeholders. And I guess Lily and I both kind of came to this project identifying this irony that there is these products are designed for very vulnerable users, and yet some of the very most vulnerable users of these apps were not actually their needs were not being designed for.
I think it's clear that we need digital solutions to meet the care needs in mental health going forward. But we need to have a really robust societal debate about what shape they're going to take and how they're going to be regulated and how they're going to be designed. And so I think that if this paper contributed to facilitating first further connections and discussion between industry stakeholders, clinical, medical stakeholders, academia, but then most importantly, people who actually are in need of this care and support. And of course, there's overlap there, right? People who need mental health tools. I think if that discussion could be enriched and facilitated, then we would have met some of our goals. So to spur continued debate and to widen the scope of the ethical considerations being taken into account.
We hope this report will be part of a very big conversation that is relatively new because regulation in this space is something that ethicists of technology have been keen on for a very long time. We're part of a very large conversation, but we really wanted to stand up and make the case for taking diverse stakeholders very seriously and actually to say that they should not be forgotten about, particularly when designing in this space.